Good afternoon, everyone. Thanks for joining us. We're going to give folks just a few minutes to get logged on, and then we'll get going. Ashton, what do you think? Another minute or two?
Yeah, we'll give it one more minute and then we'll get started.
Awesome.
All right, let's go ahead and start. Welcome, everybody, and thank you all for attending the Council of State Governments Justice Center's Expanding First Response Assessment Tool Launch webinar. During today's webinar, we're going to talk with you about our Expanding First Response Assessment Tool. And we're really excited to discuss this with you. We're definitely hoping that this tool will help communities to determine where they are in either planning or implementing or sustaining a community responder program. And before we get into everything today, we'll quickly define what a community responder program is. As we're using it, a community responder program is a mobile response that sends health professionals, social workers, peers, community health workers, coupled with emergency medical technicians at times and other physical health professionals. And it sends those health professionals to 911 and other urgent calls for service as first responders. And Anne, I'll give it to you to talk about CAHOOTS and being the first community responder program.
Sure. Well, we're really excited today to share the assessment tool, which is really a second step in the work that we've been doing at the Justice Center to help communities across the country explore, sustain, and implement community responder programs. So as Ashton mentioned, we use the term community responder as a term that defines unarmed civilian responders that respond to community members in crisis or distress, oftentimes due to poverty, behavioral health, substance use, disability. It really depends on the community. And community response is a new arm of the traditional first response in the United States and Canada. We saw that CAHOOTS, which a lot of folks on this call I'm sure know, started in 1989 in Eugene, Oregon. And it was really the first alternative response to law enforcement or fire to community members in crisis or distress. After the George Floyd murder in Minneapolis, we saw communities across the country just looking towards established community responder programs across the country to find ways to implement and sustain their own alternative response models. So really, we're building on the framework that the Justice Center has done in the last 2 years around their expanding first response toolkit and now this assessment tool.
Yes, and so the purpose of today's webinar is twofold. First, we want to explain how and why the Expanding First Response Assessment Tool was created for community responder programs. And then our second aim is to train you in how to use the tool. So we're hoping that you'll be able to refer back to this webinar as users for support when filling out the tool. The tool is now accessible on the Expanding First Response Toolkit website, and we'll be actually walking through it later today in real time to show you what it looks like to complete the tool. And we'll also be holding time at the end to answer any of your questions. So, please feel free to, put anything in the chat and to ask any questions throughout the webinar, and we'll be sure to answer as many of those questions by the end. And so I'll give it over to Anne to introduce herself.
Hello again. So Ann Larsen, I'm a program manager at the Justice Center in the Behavioral Health Division. I'm lucky enough to work with Ashtan and some other folks around community response. It's 100% on my portfolio is helping communities across the country or gather information, share technical information, really elevate and amplify the work of community response across the country. I come to this work from having real experience implementing and creating a program in Olympia, Washington. We started a crisis response unit and familiar faces program in 2019, and those programs are still up and running today. So I come from an experience of having gone through the trenches and working through all of these different phases to implement a program. And I've been at the Justice Center since February. Ashtan?
Yes, I'm also very happy to be working with Anne. I've learned a lot from her, just in her being, as someone who has a concrete experience with building a community responder program. It's been really exciting to see how it's played out in our work. And but my name is Ashtan, and I'm a senior project analyst here at the Justice Center. Before coming here, I did research and policy analysis on different topics such as law enforcement accountability and mental health and prisoners' rights, as well as hate crime prevention. And so now I'll hand it over to Anne to give a brief overview of the Justice Center.
Great. So at the Justice Center, we are a nonprofit, nonpartisan organization that works with all the branches of government. And we really pride ourselves in policy and research, in elevating the work that we do across the whole spectrum of behavioral health, state initiatives, corrections and reentry. So yeah, next slide. So our goals at the Justice Center are to break the cycle of incarceration, advance health, opportunity, and equity, and use data to improve safety and justice. That's really important in this work too, especially when we see that there has been a lot of momentum and social outcries around exploring alternatives and really grounding the work that we do in community response as it's the right response for the right calls, and grounding that information in research and data. Well, we wouldn't be here today without our good friends at Alkermes who funded this assessment tool. So understanding that communities need a toolkit, they need information, they need to know what other communities across the country are doing, which is what the Expanding First Response Toolkit does. And then a complement is these assessment tools. So the Justice Center is really well versed in technical assistance and assessment tools, and that they found really moving communities in their initiatives, whether it be around Second Chance Act or around justice reinvestment, is that having an assessment tool really helps communities get where they need to go. So we applied for an Alkermes Inspiration Grant last year, and this is the result of it.
And so just a little bit of housekeeping before we get into the fun part. We definitely want to hear from you. And so if you would, feel free to introduce yourself in the chat, or also ask questions using the Q&A function throughout the webinar. But we just really want to hear about, who you are and what kinds of jurisdictions you're coming from and your community's identified needs throughout the webinar. This isn't just about informing you about the tool, but it's also about connecting with you. So please feel free to let us know who you are in the chat if you're comfortable. And we'll move on to the next slide.
Yeah, so as Ashtan said, we really do want this to be interactive, and we want to know a little bit more about you since you know about us. So our first poll that we're going to ask is, what is your role? Are you an advocate, social service provider, community responder program manager, elected official, law enforcement? Are you someone with lived experience? So this is our first poll to find out who's in the room.
We'll give you about a minute to respond. Looks like 30 out of 40 folks have responded so far.
Looks like we're getting a lot of others. So this really helps us inform the work that we do, or if we're missing really an important role in this work, this will help us do better, like reframe things. Do we need to make sure that we're including dispatch in this list, or including things? So if you are one of those others, if you want to put your role in the chat, that would be awesome, so that we can collect that information and make sure that we are more representative of folks in the room next go around.
It looks like people aren't responding as much anymore to the first poll question. So is it possible to share those results out to everybody? So yeah, it's looking like Anne said, a majority of the responses are other. So, you know, really excited just to see what other kinds of roles we should be including when we think about this work. And we also have advocates coming in second. And we also have some community responder program managers.
Great. So we'll move on to the next poll. Poll number 2 is asking, let's see here. There we go. Where are you? So are you a rural community? Are you an urban community? Suburban? Are you on tribal land? So where are you, and how do you define the community that you're here hoping to learn more about? I'm in a tricky spot, like I'm kind of rural, but like 5 minutes later I'm suburban, so that's why we put the combination in there. All right, it looks like combination, urban, are the leaders on that one. That's good to know. Thanks, Andrea. So
Okay, so next slide. Yes. So basically, before we show you the tool, we want to explain the foundation for it. So some of you might already know about our expanding first response toolkit, but this toolkit was created in 2021, last year. And the expanding first response assessment tool is a complementary component of this toolkit. So we'll see later throughout the tool, everything is sectored out into these categories that we see listed here, all of these policy sectors with community engagement and needs assessment and data collection, call triaging, financial sustainability. So we see all these categories represented here, and these were the ones that we decided to design the community responder program toolkit after in 2021. Because the specifics of community responder programs, they vary from place to place. You know, people are going to design their local community responder program in a way that really meets the needs of their own community. And so we engage with people in the field, and they let us know that they needed information about how community responder programs operate and, you know, how to staff them effectively, how to actually get out in the community and engage with people so that it's sustainable, how to fund it so that it's sustainable. And so that's why the expanding first response toolkit was structured in this way. And the tool that we'll be talking about later is also structured in the same way. So after the webinar, you'll be able to access the assessment tool, which you know, is organized in this way. And we can now move on to the next slide. All right, so another poll question. So we're interested just to see what kind of you know, consultation or support you're seeking, you know, whether it be around call triaging or collecting data, or, you know, trying to identify funding opportunities. It's just helpful for us to see, you know, what guidance you're looking to, so that can inform future resources that we provide. So it's looking like call triaging is in the majority so far, which is definitely definitely not a surprise. That's a consistent need that we've identified. Kate says she wants all of them. Well, good news, you will get all of them through the tool. But yeah, it's looking like call triaging is in first place. We have community engagement. That's also a section that people are interested in, data collection as well. But yes, all of these sections receive, ample attention in the tool and the toolkit. And so we're definitely looking forward to showing you how that plays out. Next slide, please. Or wait, we can share out the poll results. And then, yeah. All right, I'll give it back to you, Anne.
Thanks, Ashton. So one of my favorite parts of the website is the program highlights. So we have programs from across the country that are highlighted. And in the program highlights themselves, we do break it down into how they did community engagement, how they did needs assessments, how they did call triage. And just as diverse as the folks on this call are diverse as the teams that are highlighted in the program highlights section of the Expanding First Response Toolkit. So on the left, we have the Atlanta PAD team. Atlanta sends out harm reduction practitioners. So understanding that the calls for service that they needed in Atlanta, the calls that could be diverted from traditional first responders was around substance use. They dispatch harm reduction practitioners. They get dispatched by 311. Oftentimes, first response or alternative programs get dispatched by 911. But we wanted to show that there's different ways to do this. While Cahoots is an amazing example of what can be done and what is possible, we all don't live in Eugene, Oregon. We live in our own communities and have our own issues and folks that we need to connect with. In the middle, we've got San Francisco. San Francisco has a 3-person team. They have a peer, they have a clinician, and they have a paramedic. They're able to address immediate medical concerns. They're able to have that peer to make that connection and really advocate for folks. And then they also have a clinician that's able to understand what psychosis can look like, understand what somebody is going through. On the right, we have the Portland Street Response Team. Portland is underneath their fire umbrella as well as San Francisco. So we're seeing a lot of these teams partnering up with fire departments. Fire departments already have the infrastructure in place to receive dispatch calls for service in the community. They also already respond to an enormous amount of substance use overdoses, mental health calls, poverty calls when it's around survival fires. So our firefighters are being dispatched to a lot of calls that could potentially be diverted to a social service response, like a peer with a paramedic or a peer with an EMT. We're seeing a lot of nurses that are becoming a part of these teams as well. So we just really get excited about amplifying and showcasing programs across the country that are doing great work. And it's always kind of fun and interesting to see how they take their own little spin on the issues or the building blocks of expanding first response. Next slide. Is this me, Ashton?
It can be. We had you down to talk about this, but I'm glad to too.
Oh, I'll stay. I'll go.
Okay.
So when we were building out the assessment tool, we really wanted to make sure that we weren't like flooding folks that are in the exploration phase in their community with information that would be relevant to somebody that's operating a responder team that's running 24/7. And so when we built out the assessment tool, we have 3 tools that we are going to showcase today. So there's a readiness tool, which has exploration and planning underneath it. There's an implementation tool that has early implementation underneath it. And then there's an operational, which has when folks are piloting programs or when they're fully operational. So we do break it into 5 specific phases, and those definitions are going to be in the assessment tool. So don't worry that you're not going to remember them. But as we look at exploring, there are a lot of communities out there that are truly just exploring what is possible. And so maybe they heard something on the local news, maybe they read an article, maybe they work for a mayor or an elected official that says, hey, we need to explore XYZ. I heard that there's programs out there doing this. So in the exploration phase, that's truly just where you are. You're just like, what is out there? How can I gather more information? Who can I connect with? In the planning phase, we define planning as maybe there's a grant opportunity that is available. And so we really need to like get folks together, or maybe we're going to earmark a little bit of money, or maybe we're going to tap this person in this nonprofit or in this government agency to start planning an alternative response program. So there may be funding, there may be a program manager, those two might come together in that planning phase. And then early implementation is where we see a lot of teams across the country right now is they've got money. They took that momentum from 2020. There was earmarked money. They've hired a program manager. They're meeting with folks in the community. They're discussing how the team's going to be dispatched. They're discussing what the staffing is going to look like. They're coming up and finding successes and challenges as they work through all of the different issues in developing alternative response. So we see a lot of communities in this early implementation, and we really want to help them move into piloting. We really want to see boots on the ground and testing these programs in the field. Piloting is we have not seen a team that has skipped this phase, but there might be some out there. So usually we take all the information that you've gotten from the first 3 phases, and you determine that you're going to pilot a program during these hours, with this staffing, with these types of calls, and you're gonna try to demonstrate success, or you're gonna try to tweak things and figure out, ooh, that didn't work. We need to allow community members to flag us down, or we need to allow more time for the team to transport people. So they're figuring things out during that pilot phase. And then fully operational is where we see a couple of these programs across the country. They're growing monthly, which is great. And we're trying to capture them and highlight them and amplify their work. But fully operational, these are new teams. You know, if we're looking at Cahoots from 1989, obviously institutionalized as part of the culture of first response in Eugene, Oregon. And then the second one being from 2019, there's still a lot of things that these sustaining teams need to keep in mind around, are they dependent on one champion? Are they dependent on a program manager to be successful? Are they memorialized in the city or the county? So how to really support fully operational teams to make sure that they can sustain any kind of political change or budget change in their community. Next slide.
So so now we want to, ask you, now that you've gotten information about what phases the tool is broken down into when building a community responder program, we want to see where you all are at, if you're in the exploration phase, the planning phase, early implementation, the pilot program phase, or the fully operational phase. And we have some brief definitions here to, re-jog your memory. We know there was a lot of information about what phases or what, but if you could do your best to guess here, what would you pick? We'll give you about a minute to respond. So it's looking like the majority of you are in the exploration phase, which is what we were expecting. When we go through the assessment tool, which will happen pretty soon, we'll be going through an exploration phase assessment just to show you what that will look like. And so, yes, it looks like yes. So the majority of you all did respond with exploration. After that, we have people who are in the planning phase. So they're taking the steps to implement a program. They've already been able to, consider whether or not a community responder program is the best kind of response. All right, so next slide. Thank you. So for the assessment tool walkthrough, this is a breakdown of what it's going to look like. The tool, we have been working on this since, I believe, March of this year, to make sure that it's designed especially so that you can, get all the information that you can out of it. And we're really excited about this tool because community responder programs, they really do have the potential to create a public safety system that is built around care instead of unnecessarily punitive responses. And so we see that there is developing evidence that demonstrates that these programs can reduce crime and they can prevent unnecessary transports to hospitals while increasing connections to care. They can also reduce taxpayer costs by cutting back on the need for traditional first responders. And so we're excited to present this information to you. And in the tool, we'll be taking you through the introduction, the getting started section, how to select an assessment tool. And then we'll be showing you an example with the exploration phase. We'll then get into the 5 steps recommendations that you'll receive, depending on your responses, as well as learning opportunities and connections depending on your responses. So the tool is designed so that if you do respond to less than a majority of questions with yes, then you will receive 5 steps that you can take to move forward in that phase and move on to the next phase. And then if you respond to, a significant number of the responses with yes, and you're, well on your way in the phase, then we will give you opportunities to get resources for technical assistance and connecting with us at the Justice Center, to amplify your success stories to people in the field and to help them build out their own programming. And so now we're going to close out the slideshow and I'll share my screen and take you all through the exploration phase. So let me go ahead and do that. Okay, can everybody see? Amazing. Okay, so this right here is the Expanding First Response Toolkit, and the assessment tool itself is built into the website. So you see here, if you go to the Expanding First Response Toolkit website, in this top bar, you'll see assessment tool here. So we'll go into that. And this is the assessment tool. I'm going to minimize. There we go. So the assessment tool we have here with the introduction page, it provides the information that we've already let you know about, what the tool is and why it was created, who it's funded by. We'll then get into the next page. So this page is significant here. This is the getting started page. So this will break down what steps you're going to take in the tool to get the results at the end. So first you will select the appropriate tool based on the phase that you think your program is currently in. So we already saw that a lot of you are in the exploration or planning phase. So we see that, you'll fall into any of the phases here. And then we get into answering the questions. So for each of the questions within a phase assessment tool, you're going to respond with yes or no or unsure. So all the questions are designed so that it's basically going to be responded to in a yes, no binary or unsure if you're in between. And so we hope that the assessment tool will take no more than 15 minutes to go through. We've been able to test it and it's taken about that long to finish it. We'll be taking our time today because I'll be explaining all the questions, but we're thinking that it should take about 15 minutes or so to answer all the questions within an assessment. In addition, once you've responded to all the questions, you're going to receive your results. So you'll receive a downloadable PDF file. In addition, you'll also have a page where you can see all of the responses that you've given. And in addition, we will also, be able to contact you 6 months after you've completed an assessment to check back in and say, hey, have you, made any progress in your phase? Are you looking to move on to the next one? And so we definitely want this to be as interactive as possible. That's the way that the tool has been designed to for the user to have an interactive experience and, really be able to take some clear takeaways from the tool. Is there anything that you would add there, Anne?
No, I think you did a great job.
Okay. All right, let's move on. So we're now in the select assessment tool page. So we have the different types of tools. We have the readiness assessment tools, the implementation assessment tool, and the operational assessment tools. And so what we're going to do is pick exploration. But before I get into that, I want to show you that you can see the definitions of each of the phases within this page. So we define what each of the phases are. In addition to that, we also get into the actions that a community can take during the exploration phase or during the planning phase, and so forth. And this is to sector things out. Of course, some phases will blend into each other. Like there are things that you might be doing in the planning phase that you're also doing in the exploration phase, but we did our best to sector everything out, just so that we can break things up into, clear, digestible actions that you can take that, don't feel too overwhelming. And so we also have, of course, pilot program definitions as well as the fully operational phase defined here. So for the exploration phase, we see here, that's the one that we're going to pick. This is when a community is, considering ways to expand response and trying to identify the needs and, to, divert people away from traditional first responses, specifically people who are experiencing mental health crises or issues with substance use disorders or co-occurring disorders or poverty. And these are different actions that you can take during the exploration phase. You can hold community discussions, however you choose to structure those. You can foster relationships with existing traditional first responders so that people can be successfully diverted. You can look at funding opportunities. So, okay, we'll get into all that later. I'm getting excited. Okay, so I'm going to pick the exploration phase. So just like we did before when we asked you, about yourselves, we have the user to fill out, non-confidential information just about what kind of position they hold. So I'll just put that I am a social service provider. I'll put that I'm in Gallatin, Tennessee, which I am, and that I'm in a rural area. All right. So after I've entered in all the information here in the Tell Us About Yourself section, then I'll go next and it'll take me to the first section. So as we talked about earlier, the toolkit is designed in the following sections with community engagement and staffing. And that's how the tool is organized too. So first, we will start with community engagement. So the kinds of questions that we have here in community engagement, they're dealing with, have you reached out to people that you're interested in having in your advisory group? And that can be people who have lived experience with arrest and incarceration, at the intersection of mental health, substance use. It can be people, locally elected officials, or it could be people who are government staff that, are specifically in charge of overseeing a community responder program. It can be behavioral health provision folks in the community. So we basically have that. We have, whether or not you've started reaching out to those folks to gather them together, whether you have defined what the advisory group might focus on, and then also looking at, whether or not your city or county officials have, I'm sorry, is this the right? Did I pick the right one? I feel like I picked the wrong one. Sorry, guys. Okay, yeah, it is the right one. So just making sure, but yeah, anyway, so getting back into it, city or county officials were asking you whether or not they have established a model for holding like local listening and learning sessions to hear from the community about what needs they have with the community responder program. We also ask you, whether or not your team members are familiar with how to actually engage with people in the community in a consistent way. We see that community responder programs are most successful when they have at the front end connected with those who are impacted by law enforcement or traditional first responses and people who have direct experiences. and engaging them at the front end, getting information from them, but also engaging in consistent communication. So not, only having the listening and learning session or information gathering session, once, but really, having actual relationships that you're building with people and having that happening consistently. So I wanted to see, Anne, if you had anything to add to this section.
No, I mean, I think as folks in the room probably understand, it's a really important part of building a community response program is really, if it's going to be community led and community specific, you do need to engage your community. And that can look like a host of different ways. When I was at Olympia, we had listening and learning opportunities, and we allowed advocates to have their own listening and learning opportunity. We allowed business owners to have a safe space to talk about what they thought an alternative response should look like. We did surveys with law enforcement and other first responders through SurveyMonkey. So there's a lot of different ways that you can get the information, and that really helps frame what your community is looking for, because in Olympia specifically, we heard advocates say that they would never use the 911 system. And then we heard businesses say that they would only use the 911 system. So you need to get a wide variety of perspective on whether it's going to be an impacted person, their perspective, or somebody that's going to be calling and wanting to know what the response is going to look like.
Yes, thank you, Anne. That's really helpful. And the reason that I'm responding to these questions with no and unsure is just so that at the end, you can see what it looks like to get the 5 steps product to move forward in that phase. So the next section is needs assessment. So this is a significant section at the front end, in that before you can design a community responder program effectively, you want to see what kinds of services people in your community are needing. So we structure the questions in that way so that you can we basically are asking you whether or not you've explored what kinds of calls that you would be responding to, what kinds of resources people are in need to. Like, for example, are there a significant number of homeless folks that are being, funneled into the justice system as a result of people calling traditional first responders on them? That's something that we are, trying to gauge for you in this section, is to try to understand what gaps might exist in your community and what needs, exist there. And so in addition, we ask you whether or not you are coordinating with the current systems of crisis and community care. So the current behavioral health providers and crisis stabilization units and, 911 dispatchers that you're seeing in your community as it pertains to crisis. If you've been coordinating with those folks within those systems and, establishing context there, also getting into if you've identified the gaps, which we've, reviewed earlier, and then also looking at what kinds of call types you're looking to divert. So, for example, trespassing calls or other calls, with low-level disturbances where people don't need to be, funneled into the justice system, but rather into, care and mental health resources or housing and so forth. So that's how we've structured this section. But Anne, I wanted to give it to you too, to see if there's anything you would add.
Yeah, and I don't think you should feel like you need to have, everything explored and every, data point at your fingertips. A lot of this information will come up during your community engagement. So you're going to know that there's going to be gaps in your crisis system. I mean, that's inevitable. We all live in communities that have gaps in their crisis system, and that shouldn't be a barrier for you to move forward. But you're also, when you're identifying gaps, you might identify really large strengths in your community. Maybe you have a really robust faith community that's invested in an alternative response, or maybe you have a really great social service provider that does a really wonderful work on engaging encampments or engaging houseless folks. So this is just really to for you to customize the work that you're doing for your community specifically. So if you've identified gaps, it doesn't mean that you have to stop there. So this is just for you to think about what you should be thinking about as you move forward.
Yes, absolutely. Definitely don't feel like you should be responding yes to all these questions. this is really put in place so that you can take the steps if you haven't already. For program staffing, we have 2 questions here. So we're just trying to get at whether or not you've looked into the different kinds of models and staffing options. You don't have to, specifically pick one yet, but if you're in the exploration phase, trying to get an understanding of the types of models that are out there, which you can receive information about that within the toolkit itself in our community responder program staffing section. It includes information on the types of models and the types of funding streams that you can use for a community responder team, because community responder teams, they can be 2-person teams, they can be 3-person, 4-person. It really depends on what you've assessed in your community and the types of needs that people are having that will, influence how you structure your community responder team. And so in thinking through that structure, you also, we encourage you to think about what kinds of skills you're looking for your community responder team members to have, and how you want it to be structured. If you want for there to be a lead, and then for other folks to be supporting that lead in the team, and how you see that happening, or if you want it to be much more lateral and a multidisciplinary approach, that can be another way to think about it too. So, Anne, is there anything you'd add here within staffing?
Yeah, I think firsthand, a lot of us, or a lot of folks, are really trying to emulate a CAHOOTS type program. In Washington State, where I'm from, EMTs can't work for nonprofits or hospital systems. They can only work for fire departments. And so having an EMT was just not an option for our crisis response unit. We just talked the other day, and there should be a program highlight of them coming up soon, that in Dayton, Ohio, they have a really, really great mediation center. And so they have behavioral health specialists teamed up with mediators. And they saw a lot of their calls for service were around neighbor disputes and things that really needed that kind of mediation type work that some responders are responding to. And so I think that there's so many options out there on how you staff these teams, that it's really exciting to see all the opportunities of folks that can respond to community members.
Yes, the opportunities are endless, and it's really exciting work just in how different teams structure themselves depending on the community. So now in getting into call triaging, so the questions that we have here are basically just trying to get at whether you've identified, local crisis numbers in your community, and any entry points that people can have into the justice system through different ways that people will call for help when someone is in crisis, or when there's an issue that they can't resolve without additional services. So we see here that different examples of local crisis numbers can be 911, 988, 311, 211. We see all kinds of independent call centers that are popping up as people are trying to find ways to respond to situations that don't escalate the situation further. And we're also asking you within this section if you've mapped out or determined how your team can be dispatched. So, trying to see if there's a specific area that you're wanting to focus on, and the kinds of call types that you're wanting to respond to, and if there's a script that certain dispatchers should use so that people can be diverted successfully to your community responder program. So mapping out that sort of strategy in terms of how your team can be dispatched by the call centers that you've identified. And then in addition, of course, we ask you if you've identified who the folks at those call centers are, people who you want to build relationships with and connect with, meet with, express your goals with, and, really get on the same page so that there isn't any miscommunication, and so that the dispatch and the triaging is as successful as it can be. And so that's how we've structured call triaging. But Anna, as usual, I want to see if you have anything else to.
Yeah, no, I think that oftentimes dispatchers get left out of the conversation in program development, and really understanding the stress and role of dispatchers in this work is super important. So having them be a part of community engagement, for sure, having them talk about needs assessment. So having traditional 911 responders or crisis call takers at 988, being a part of the conversation early on is really important, because they are an integral part of this work, especially if you're looking at having an alternative response that is directly dispatched through a traditional 911 system. Understanding the work that they do and them understanding the work that you're trying to do will be vitally important. Don't forget your dispatchers.
Yes, don't forget your dispatchers. So when you are doing the community engagement section, try to think through, what kind of advisory group members you'd like to involve. And, of course, involving leadership from a call center could be helpful, but even involving someone who just, is regularly answering those calls, someone who's on the ground and understands just the ins and outs of the system, that can be just as helpful too. So we'll move on to data. Okay, so for this section, we are getting at, how you're housing your data, how you're keeping certain data private. So, any confidential information. So like someone's name and address and, history of justice system involvement, things that, people don't need to be privy to, ensuring that that information is not, solicited out to any other entities that, shouldn't have that information. So trying to understand how you want to ensure data privacy for the people who you're serving. We also get at, in addition to that, so we have the confidential data, but we also want to make sure that you're able to capture the outcomes of your program and share those out with, funders and people in the community to build transparency and community involvement. And that kind of data, while it won't be personal, that'll be like the number of calls you're responding to, like the call volume and the types of calls you're responding to, the number or the percentage of people that are receiving services from those calls, or even denying services, where they're being diverted to, where they're being transported to, even just the type of place they're being transported to, if you don't want to get into the weeds there. But so just making sure that we're really differentiating between what is private data and what is non-confidential data. And I think what we've been seeing, even with Portland Street Response, they have a pretty helpful data dashboard model that you might want to take a look at if you have the time. It shows, how to put out your data in real time and to show, what the outcomes of your community responder program are. And then we also we want to see if you've been thinking about who's responsible for collecting the data. Is it going to be an individually hired person, or is it going to be someone who has multiple roles within your team? And also getting at, what kinds of data outcomes you want to measure. So, what are you looking to capture? Are you looking to capture the number of people that were diverted away from, emergency rooms or justice system contact through your program? Are you looking to, see even the demographics of who you're serving in terms of age and race and gender? And those are different metrics that you can use to even ensure you're involving racial equity or gender equity. So these are the different things that we have within that. But and is there anything you would add?
Yeah, I mean, especially for folks that are exploring or planning, data can be super scary, and it can be intimidating. And so I was horrible about collecting data. I have a big heart and I got the team out on the street, but when it came to collecting data, it just wasn't forefront in my mind. And it was really important to skill up and build data capacity so that I could tell the story about the work that the team was doing, because they were doing incredible work. And so there's multiple ways to get data. Like if you're using data to inform your program design, you could do, I think that sometimes we overcomplicate things. I think that if you're in a smaller jurisdiction or you're one person, what I initially did for one of our programs was I asked our downtown walking patrol officers, so officers that worked in a certain area, the names of 10 people that they came into constant contact with that they really they weren't the right response to come into constant contact with. And they all wrote down these names like lickety split. So sometimes people know the information, and I could validate that information with seeing the number of calls, that are coming through the 911 dispatch system on those folks. But don't be afraid. A lot of people are looking just at how to build data capacity, where to find data. And it is really important, and there is help out there, but it can be intimidating. So we're trying to provide as much support and resources around data collection as possible.
Yeah, that's really helpful. And I'm glad you added that. I think too, sometimes people think of data as only being quantitative, but like you just shared, it can be qualitative too, meaning it can be narrative based and based on people's stories. And so sometimes it is, the anecdotal information that you can get from first responders that are already in the field about the types of folks, who could use other services and, don't need to be repeatedly, having law enforcement called on them, and they can get diverted to the proper resources. So yeah, that's really helpful to hear. And I think it's something to definitely think through. And so moving to the safety and wellness. So for this section, we are essentially just asking you if you've been thinking about ways to address any safety concerns around unarmed community responders. This is a concern that does come up and causes some pushback against community responder programs, but we've seen to date that no community responder program, teams have been significantly harmed, like individuals haven't been harmed in the field. We haven't seen that happening. And that being said, the concerns are still there. So trying to ensure that you're thinking about how do we talk with our community about how, they can be ensured that community responders are safe and that they're responding to these issues in the field in effective ways. And then in addition, we also try to, get you to think about any other programs that have addressed safety concerns in an effective way with their team model and the kinds of information that they put out about their team, even like their data. That could be something. One thing I've seen is that people have said, oh, a majority of our calls, we haven't had to call for any law enforcement backup. And we've been able to handle the calls without involving, that kind of response. That's a way to even sort of, calm down anyone in the community that might be concerned. And in addition, we also get at whether or not you're using, trauma-informed practices and thinking through how your team is, responding in the field, and then even how they're responding to each other and ensuring that there's a healthy, work-life balance. And all of these factors are really important to ensuring that a community responder team is effectively connecting people to resources in the field. So Anna, I'll hand it over to you. I know you have direct experience, so it would be helpful to hear like how you all have handled concerns about safety.
Yeah, and I think that safety and wellness go beyond what we think of sometimes. So safety and wellness can go around, are you giving your team proper uniforms? Are they reflective? Are they sturdy enough? In Washington, it rains every day. So the team, I made sure that they had like North Face Gore-Tex raincoats that had reflective identification on the back. Are the vehicles set up in a way that they feel that that clients can easily get into the vehicles, that staff can drive the vehicles? So safety and wellness covers a lot of things just beyond, I think, what our initial thoughts go to is, there's a weapon on scene. And then also mental health. So these calls are still coming in. So whether police are going or fire is going, or we're now sending an alternative team, the call is still the same. So the calls can be really disturbing. You can see just kiddos in really bad places, or people that are living in constant crisis, and can be really traumatizing to your staff as well. So just creating space there, maybe your staff, their office isn't is kind of like a safe haven for them to go to. So in between calls, they can watch YouTube videos about cats, or creating space for them to debrief really tough calls. So I think safety and wellness goes beyond just a weapon on scene, and we can really learn and see how our traditional first responders have high incidences of PTSD. Like self-care is really important. So understanding that and building that in, you'll have happier staff, you'll have healthier staff, and they'll be able to respond to the community, showing up as their best selves.
Thank you, Anne. And so now we're going to go into the second to last section where almost there. So within financial sustainability, these questions are getting at, if you've been looking at funding streams and funding sources that can sustain your program. So whether that be like institutionalized funding streams like Medicaid, or if it's, ARPA funding, or, grant funding from, a private grant organization or foundation. We're just trying to get you to think about any kinds of grants that you're looking to apply to, and that can include local or federal with multi-year awards that can sustain your program. Also, if you want to include administrative support in your funder reporting. So these are the different types of questions we have here. But Anne, would you add anything in terms of the kinds of funding sources or streams that people can be thinking about?
Yeah, I think a lot of these programs get kicked off by a grant opportunity or like a one-time funding source, which is really great. But, to give staff that peace of mind that they're not going to be, oh my gosh, is this a grant funded program? Am I going to be looking for another job in a year? So just really being cognizant of these. There are opportunities out there from one-time funders, or maybe there's ARPA funds, or maybe just a unique opportunity. But like, can you bill Medicaid? We're seeing a lot of folks, especially teams that are underneath the fire umbrella, able to bill Medicaid for a lot of the services that they're providing, so that they're just having to find stable funding that's more flexible for things that aren't Medicaid billable. So I think financial sustainability is something that's is constantly on these programs' minds, and in finding ways to earmark funds, or through the state or local government, something to consider.
Yeah, and then another funding stream too could be your local government's budget, whether it be through the mayor's office and so forth, if that is a budget line that they can ensure that they're providing a certain amount of funding towards your program, that could be another source as well. So, all right, we're at the last section, finally. So for this one, we're getting into legislative and policy initiatives and strategies. So, essentially what we have, even within the toolkit, we have a section, legislation to support community responder models, with tips and resources. And that's what we're getting at here. We're just trying to understand whether or not you've begun to look at how community responder programs have been started through legislation, any kinds of, even if there were requirements, if there's like key language in that legislation about what the program should be doing that you found to be a helpful example that you could push for a bill, in your own city or your own county, and, connect with folks that have that legislative power to create programming and to institute it into law. Because once it is instituted into law, that does add a lot of legitimacy to the program. That legitimacy can still happen without that, but it is helpful to have legislative policy strategies at the forefront of your mind when you're thinking through how do we, ensure that this will be sustained, and that this is a program that even the city can help to maintain, or even the state. We've seen also state ordinances or proclamations from governors that have been used to institute community responder programs. So yeah, we broadly get into that here, but Anne, would you add anything? And then we'll see our results.
I think we see legislation with 988, so that influences, legislation can influence down, and folks can influence up. And so it's just exploring what other communities have done. In Washington State, we now have part of our legislative budget training. So they partnered with the University of Washington to train folks. So just being aware. I don't think, don't beat yourself up if you're not exploring policy changes across the country.
Absolutely. All right. So now we're going to submit the assessment tool. And you see here that you can see all of your results. Right now we're in the initial phases of an exploration phase. We've responded no or unsure, and there's nothing wrong with that. But this shows just a breakdown of all your responses. In addition, you get 5 steps. So we have the 5 steps are to hire an individual or a small team to serve as the planning point person. Define the priorities of your future advisory group is step 2. Step 3 is to, actually engage with the advisory members you want to start involving and setting a date for a kickoff meeting. We have, these are types of folks that you can, including your advisory board or group or whatever you choose to define it as. And we also, within each of these steps, as you can see, we provide details on checklists and things that you can use. So we don't just provide, do this, but we try to provide, individualized guidance for you within these steps that provides information on how you can move forward. And so for step 4, of course, we have completing a needs assessment. Step 5, identifying a funding opportunity, just one, that could be the starting point. And, we're trying to structure this so that it's not overwhelming and you can feel like you can take things one step at a time, one day at a time. And for here, we have the downloadable PDF. So here you'll see this is the PDF that you can have on file, which will have all of your results and all the different kinds of questions that we have in addition to the 5 steps. I'm going really fast, but in addition to the 5 steps, we have all of that in a PDF, because the way the tool works is that once you are done with the tool, you can't go back in because we don't have a login, but we do have it so that you can download your results and then keep those for yourself. So that concludes the walkthrough. Thank you for bearing through that. And now we will, open up the floor for questions. Trying to see if there. Do you all see any questions? Okay, it's looking like there aren't questions, but if there are any questions, please feel free to ask.
Yeah, and it doesn't have to stay on specifically on the tool. It could be a question that you are just looking for some guidance on. If it's a question around like who's, music or movies you should watch this weekend, I'm not going to be able to help you, but anything community responder, we're happy to help. You've got us.
It looks like Rachel has a question. Okay, she says, online instructors like my dad and I now have to triage emergencies for students. And so is your question about, okay. So Rachel, your question is about how to triage emergencies for students? Sorry, I'm trying to understand Rachel's question. Well, in the meantime, I do see that someone else is asking if we will be sending out the tool. Yes, well, right now, what I can do in the chat itself, before you log off, I can link to the assessment tool itself. So I just dropped a link to the assessment tool that you can access online. We also will be sharing after this presentation, we'll be sharing the slide deck in addition to recording and the tool and, opening things up to questions.
I saw a question in the chat from Angela. And so, yes, we do have an example. So, like a low, I think if you're asking if there's like a really low bar survey that you can send folks in your community. So we did one in Olympia specifically to first responders. And we asked like, what are the types of calls that you would want an alternative response dispatched to? How would you want this team dispatched? Are there specific hours that you find would be most impactful to have an alternative response out there, knowing that we have budgets and we can't run 24/7? And so we can definitely, I'll email you our survey that we use for first responders. When we did surveys to the community, I think you're right. You want to be just basic high points, like 10 questions of like what they imagine, like what a response would look like. Is it in an unmarked van? Is it what types of calls is the community concerned about? So we're happy to send you some suggestions around that.
Yes, absolutely. And I see that there's a question coming up about how the 5 steps are generated. So the way that the 5 steps are generated, we have it so that if someone responds to a majority of the questions, so more than 2/3 of the questions with yes, and they're well on their way in a phase, they'll receive an opportunity to connect with the justice. I forgot to talk about that, but they'll receive an opportunity to connect with the Justice Center for technical assistance and further, any kinds of learning connections or peer connections or direction to resources that can help a community in a specific sector, whether that be community engagement or staffing. And so we have that option for folks, but if they respond to less than 2/3 of those responses with yes, so if they respond like we just did with no and unsure, that's when they get the 5 steps. And they also are invited to reach out to us for additional technical assistance or additional help after they've responded to the assessment. So, because I saw a question too about technical assistance, and yes, if someone responds, even if someone responds to an assessment with a lot of yeses, they will be invited to connect with the Justice Center for TA. And there is not a cost for TA. I see Corin just asked that. It's free. So I also see a question from Ashley about she's asking if there are any programs that have divested money away from law enforcement to invest in, a civilianized crisis response unit and some of the hurdles that came with doing so. And so we actually, Ashley, if you go onto our toolkit, which I will drop that in the chat as well, the toolkit is organized so that you can see different examples of communities across the country or community responder programs across the country that have been serving to divert people away from law enforcement. And it includes in their program highlights different ways that they have overcome any hurdles or resistance that they might have come against. And so I would definitely encourage you, Ashley, to visit the toolkit to get information on that. And also, please feel free to reach out to us. You see our email addresses are here if you have other questions that we're not able to answer. Let's see. Anne, there's a woman named Anne that asked if we have best practices for data collection, data reporting, and community engagement.
Sorry, Ashton, I'm dropping in the chat another toolkit that's done by Local Progress that I think might help Ashley a little bit more with her question.
Okay.
So Local Progress did a really beautiful toolkit around this work as well. It's targeted more towards elected officials. And they do a really great, like, the history and where we are and where we can go with community response. And I think you might find some suggestions around specifically taking money from the police department to fund these types of programs. I think in Brooklyn Center, they did that, Minnesota, maybe Minneapolis. So there's that tool also. And then Vera has a really great tool as well. So wanted to drop that in there. And then Ashton, I'm sorry, I can't do 2 things at once.
No.
About best practices?
Yeah, I had seen, I saw a question that.
Yeah. So that is the really tricky thing about the uniqueness and the nuance of community responder programs. And so they are we can't even get terminology to be standardized across the board. So sometimes they're called, unarmed civilian responders. Sometimes they're called mobile crisis response. We use such different terminology across the board that it's really hard to have standardized best practices because each community is so unique and different. So that's why we try to give guidance on what to do. And we're not at a place to say this is best practice around the different issues.
All right, I'm trying to see if there are other. So I do see a question from Rachel about, how to handle the stress of, triaging students who are experiencing crisis. And I will say, firsthand with mitigating the effects of secondary trauma, that's something that people often face when they're trying to connect people to the proper services and care. And it's important for there to be wellness checks, whether you're checking in, because it sounds like I think you said your dad. Yeah, you and your dad are triaging emergencies for students. And so finding a way to have consistent check-ins where you're able to, ground yourself could be really helpful there.
I am just jumping in now because I am reading the questions. And Rachel, we actually do even have a specific college campus community responder, a little work group that we've been meeting informally with, and we've done presentations on community response programs on college campuses. And there are a couple of colleges that have good examples. Oregon State, I don't know if Ashtan has already mentioned this, but Oregon State has a community responder program on their college campus that is completely separate from law enforcement. I think Tufts has something. We see ones at Georgetown and Cornell where it's student EMS led. So one of my defaults is I can't read and hear do things online at the same time. So please reach out and I'm happy to connect you. If I'm reading your questions, just skimming them correctly around college campuses, I'm happy to connect you to some other folks doing that work.
Yes, and I see that again, Christina had asked about if we're providing technical assistance beyond the tool in the toolkit, and we are. You will receive information on that. When you complete the tool in your results, you can either reach out to us directly or you'll get information on learning connections and opportunities.
Yes, my only thing is that we really wanted to have a low barrier for people to access the tool. So that's why people don't have to register. I found that when I would find an opportunity and it was like, register for this, I would just I would just stop there and not do it. And so we wanted to have a really low bar on people accessing the tool. But if you don't put in your email address, it'll be really hard for us to stay in contact with you. So just make sure if you do want to be in contact with us to include your email address in that getting to know you first page.
Yes, and I see a question from Angela asking if you're going through your results and you're on the toolkit and you have to step away. If you click out, will it let you come back? So it won't, since we don't have, like Anne said, we wanted to make this low barrier, so we don't have a login option. So it's important to try to complete the assessment in one swoop. I will say that, one thing that we were talking about with our developer, if you do go through some of the sections and you don't finish all of them, you accidentally click out, you can reach out to us and we can, we would track down what your responses were and let you know, and you could respond in the same way, but you would still have to fill out the assessment again because we don't have, the login option, but we would be able to find that information if you wanted us to.
Yeah, we just really wanted to make sure that community members felt at ease when filling out information, and sometimes they just don't want to share their information. And so we wanted to create a really low barrier. So it was a give and take. So you lose all your information if you walk away. We won't be able to contact you if you don't put your email, but we also wanted to make this accessible to folks across the spectrum, from advocates to law enforcement to elected officials.
Okay, it looks like those are all the questions, unless if there's one that I missed, please, if you could please put it back, that would be great. But I think we covered all of the questions in the chat and in the Q&A section. Thank you, Rachel. Thank you, everyone. Anne, is there anything else you want to add or?
No, thanks everyone for sitting with us today. It was really great. We really love this work, so we're really excited to share this tool. And please do reach out. We will get back to you. So reach out if you have any questions, and we're happy to help.
Yes, thank you all for attending. Thank you all.
Is it just us?